Thank you for having me. My name is Janelle Elyse, and I am a biomagnetism practitioner. And my roots started in as an occupational therapist many moons ago. And I started off my career at Spalding Rehab and worked on the chronic pain and brain trauma unit, and have always had an affinity for patient care, especially when it comes to the mind. Mind and emotions have always drawn me in. So over time, I was practicing occupational therapy in many different facilities and having my own practice, then morphed into working with the whole person for more of a holistic model of Ayurveda, which is the oldest holistic medicine from India. And I still pepper into all of my my sessions with clients. I did miss the hands-on piece of being a therapist, so I began my journeys on the road of biomagnetism, and I have not picked my head up in 10 years because it's been a fruitful, profound practice. It is painless, it is profound, it is a modality that looks at the whole person, mind, body, and spirit. And this kind of brings us to the discussion around brain trauma and what a huge impact it has on our society. So, with biomagnetism, what is this? So, we basically are utilizing these magnets that are in a strength of something we call Gauss. And the Gauss has to be over 1,000 Gauss, which is a strength that's measured for magnet strength, in order to create change in the body. So, in order to create pH to neutralize, which infection cannot survive in a pH neutral, and also to align homeostasis in the body in order to target certain areas, whether it's the brain, the liver, the bones. These magnets are placed in polarity. So a North Pole and a South Pole magnet on the body, that's where the change starts to happen, and the body realigns and activates the health and the healing properties of the body in order to decrease the symptoms of disease and illness, whether that's emotional, trauma, physical, hormonal, pathogenic. The magnets are quite profound. A main focus at our clinic is what we call brain trauma or concussions. We see so many of them. We tend to attract a large population of young athletes, even one that play club soccer, or they've even had a good fall on the playground, all the way up to we see a good amount of Division I athletes, hockey, soccer, football, all the way up to AHL hockey level, NHL hockey, and unfortunately, we have also forced retirement NFL players due to CTE, so chronic traumatic encephalitis. So it is a massive issue in our society. And years ago, concussions weren't addressed. And now we have a lot of adults walking around with a lot of symptom issues, especially mental health, because it affects the brain, headaches, vertigo, malaise, sleep issues, depression, anxiety, just memory issues. These are significant. And I think the big misconception is that someone has to have their bell rung really badly in order, or knocked out, blacked out, in order to call it a concussion. But what we know is the brain is the consistency of butter. And when that bounces at all off of the side of the skull, we can get scar tissue. And when that scar tissue occurs, it can cause the symptoms in the brain, but it also is a magnet or an attraction that for other pathogens, other infections to adhere and it's a cozy place for them to hide. So it throws off the balance of the body and causes more symptoms. Studies have been done. There was research in 2023 that over 90% of NFL players have had concussions. And that is drastic and dramatic and something that needs to be looked at. Career ending very young. So research has been done back in 2023 where the NFL was studied, and it showed that over 90% of them had symptoms of CTE, which is a drastic form of concussion where the brain is just not functioning the way it should. And more attention is being paid to now. The unfortunate thing is that even if someone experiences a concussion, they're out of the game. They might be gone for the season. And what we know for sure is that they compound on each other. So the next one can be worse, and then before you know it, they're out. So at INDRA, what we're able to do is through the process of kinesiology and muscle testing, able to look at specific spots on the head where these impact spots are causing issues in the brain, and we're able to kind of find out how many also, which is quite interesting, all the way from 2 up until 20 concussion spots. And either one session over a few, we are able to work on healing the brain through biomagnetism with drainage, circulation, certain placement on the body to help the brain heal. And when done very quickly, for an example, my son, big hockey player, and I would bring the magnets to the rink because a couple times someone's been hit really hard over the boards, and by getting the magnets on the body very intentionally right away, they're able to get right back into the game because there's no outward symptoms anymore. There's the pupils are cooperating, all the testing that would be done, the body goes right back to baseline. So they're able to feel better, number one, and avoid delay in game too. But the overall number one thing, it's less about being out of the game and more about their health being in proper form and feeling their best, especially emotionally and physically. A lot of times we get emergent calls from coaching, from family members, from players themselves that they're in deep trouble, and they've either had old concussions that are acting up or they've gotten a new one. And what we know also is that there's over 1.9 million cases of concussion in youth sports annually. So this is a massive issue, and that's the ones we know about. We have this one professional athlete, NHL player who, when we scanned his concussions, we're able to kind of date back to when they happened. And his worst one, he actually got kicked by a sibling in his head when he was really little. And that was worse than any of the other blows that he had playing a sport that he has dominated most of his life. So we never know how they're going to show up. A lot of times, even with women, like it doesn't just have to be youth. Women will, doing laundry, and you come up and you hit your head on a cabinet or something, or a door that's open. Those have substantial impact. And what can happen is there can be irritability, light sensitivity, nausea, headache, fatigue, all of these. And when we work through our protocol and place magnets on the body, on the brain and on the body to help the drainage, over 70% of symptoms can go away within 24 hours, which just gets people back into life much quicker. So that's huge for us. So I think our oldest concussion we found was a 37-year-old concussion in someone who was probably in their 40s because they had hit their head on a flagpole when they were young. So it doesn't have to just be acute. We do very well with acute care, which is what we always love, is to catch it early. But if not, we could also look back and find out how long someone has had these issues going on, and we can target it from the concussive or brain trauma approach, but also from the emotional approach, because there's a massive piece of emotion that goes on with losing independence, losing your sport, just not feeling your best.
Yeah.
It's so amazing how sometimes we even chalk up mental health conditions, like their emotions, and all of it could be from injuries that have happened to the brain. Yeah, we've had many, because we see so many D1 athletes that they, as teams, will even come in, or small groups, and say that their play is better than prior to the sessions they've had. They're just quicker, they're on their game, their recovery's better. We'll get calls regularly saying, I just had a game last night. I'm out in another part of the country, can you treat me remotely because I can't get there and I have a game tomorrow. And they've and we're not also I want to give credit. We're not talking about someone who's been hit so hard and that they're having bleeding or they need to get to the hospital. We're not saying throw some magnets, you're going to be fine. Within reason of concussions, because it's less about the one blow and more about the cumulative effect. So if we can help them to decrease the cumulative effect of it, it keeps their performance level and their baseline much more strong. So we'll get calls and we end up placing remote, as we had said, where we'll place magnets remotely, meaning we put the magnets on a flat surface on a table, acting as if the person is right there. We send the energy to them. Sounds hokey, very scientific. Think quantum physics. That's what we're talking about here. Dr. Joe Dispenza, one of my favorite practitioners, describes in detail about how energy works and how we don't have to be in one location to feel the effect of what is being administered to us or from us. So that's what we do. And a lot of times people won't even know we're placing at the time, and they'll text and say, did you start placing because something's changing in my body? And those are super cool events that we come into contact with all the time. Yeah.
How does the concussion leave the body?
Yes. So what happens is it's more about healing the tissues, and this doesn't happen spontaneously. Sometimes it can take over the 24 hours, up to a couple weeks, for the brain to heal, because what happens with magnets is they're anti-inflammatory. They increase circulation, and the more circulation we can get to an area, the healing occurs. Also, what we have found is because infection is opportunistic, it goes to areas that it can hide in scar tissue. So it will find, wow, this brain has 7 spots on it that I can hide. It's so brilliant that it goes and hides in those places, and then in turn, it's not just the scar tissue or the scars on the brain that are causing the issue, it's the infection load and the symptoms that they cause that are causing brain fog, headaches, vertigo, mood disorder, sleep issues, balance issues, all of that. So a lot of times when we work with someone, we ask the body, are we working on the infections, the symptoms of the infections, or are we working on the concussive piece? Because are we removing the effect of the pathogen first to let the brain heal, or do we work on the brain so the pathogen or infection doesn't have as much of a grip in the brain? So, and by that, we just do through our scanning process and our muscle testing, and we trust that completely.
I imagine that a lot of athletes who have mental health issues find other infections that are contributing to symptoms, and then it's not all concussion. Like there's
Right.
There's so much longevity that comes from that. You don't have to worry as much. It's good for the body if they have other underlying pain that they think is chronic, and it turns out that it's rooted in other things you find.
You bring up a great point, because a lot of times with these athletes, it's not just the brain. They could have injuries, back injuries, surgeries, you name it, just repetitive use injuries. And with the use of biomagnetism through our brain, we have a pain protocol that we use. We're able to alleviate a lot of those pain conditions because we're bringing decreasing inflammation, increasing circulation. That infection load we talked about has less of a grip, as well as the emotional state, because any of us who are feeling like we can't perform our best due to pain, it takes a toll on the mind. And then depression kicks in, anxiety kicks in, irritability kicks in. So what we find is there's a really nice balance that occurs when we can utilize the magnets for the mind and the body. So we're going to talk a little bit about one infection that, in my opinion, is a very prominent one that doesn't get talked about too often, and that's Epstein-Barr virus. And this is the virus that actually is super transmittable. It's super contagious to the self and others because it's through droplet form of spit. So especially in our high school, college population, where people are sharing cups and they're in close contact, this, when not managed properly and the scale gets tipped, turns into mononucleosis, which a lot of us know mono in college is a big deal. And someone could be out for quite a while with that. So we find with biomagnetism that viral loads, the magnets work beautifully on. They really find a way to help the body get into homeostasis and alignment where that virus doesn't have the same grip on the body. So then symptoms of, they'll start sleeping better. Their emotions are more stable. The headaches might dissipate a bit. Brain fog might go away. Anxiety, because we know it's one of the number one causes of anxiety is Epstein-Barr virus. And we see this literally in probably over 95% of our clients. So it's a real issue. And hand in hand, the Epstein-Barr loves the brain. So a lot of the magnet pairs go on the brain for Epstein-Barr virus. So that's why we look at, especially with our young athletes, the combination of the brain protocol and the Epstein-Barr together. That's a huge 1-2 punch that brings health in the most wonderful of ways.
So you see a lot of people going through puberty and menopause mostly, and even boys that struggle with hormones.
Yeah, we'll give a big shout out to our moms and our female, just women in general. There are started off as our biggest clientele, and things are shifting now where men are really piling in because they're seeing the benefits. But I noticed that there was a big piece that was missing or needed to be focused on in biomagnetism, and that was hormone management and looking at the fight or flight for the nervous system, because so often as women, we're balancing a lot of things. And a lot of times women tend to put themselves last. So we try and promote an atmosphere where you come in and we hear the stories and we basically are assessing what's going on with this body. The hormones might have some significant dysregulation. That might also be because there's an infection load underneath, but it also could be because there's been some old traumas that have never been dealt with. So this sweet body has been pumping cortisol and the adrenals have been working so hard to just stay in survival mode. And that's not good for anyone. So we have developed multiple protocols that help with calming the nervous system, regulating the vagus nerve in the body, which is one of the master nerves that regulate mood and intuition. We work on the limbic system. The limbic system is in charge of our emotion center, our primal emotion center. And we work on the emotion scale. So everything from peace and joy and love and lack thereof, all the way down to guilt and shame and feelings of being unsafe. And these might not even be outward emotions people are aware of. They are stuck in that subconscious. The body does a brilliant job of suppressing emotion to keep us safe at times and to keep us functioning. And at INDRA, we're able to do scanning and open up that in a very safe way with ultimate permission, a way of softly unlocking these emotions so the person can start to process them. And then what we start to realize is that hormones start to regulate, sleep gets better, emotions stabilize, there's a softness and a calm that comes, and maybe even hot flashes slow down. Someone might have symptoms of sleep issues that start to get a little bit better. So we look at the physical symptoms of perimenopause, menopause, postmenopausal, memory issues that can come up with that, as well as the emotions that also surround. And then we look at the puberty. We'll look at puberty because a lot of our kids, we try and see them prior to puberty hitting, because we've noticed that if we could work on the body and work on emotion, but also work on infection load and hormones prior to puberty, puberty seems to be like lighter fluid on the body where everything exacerbates and gets more intense after puberty. So if we're able to keep that body aligned through regular magnet treatments, biomagnetism treatments, the body regulates itself in a way that PMS is easier on the body. The emotions are more stable. And a lot of times we'll have monthly, our teens come in to get their hormone resets and different things, and they realize that they just feel better because of it. Also, not to discredit our boys, because people don't realize that men and boys also have hormones. So when we're able to look at the whole hormonal body with the emotions and the infections, they just are performing at their best. Because a lot of times we'll hear, I just don't feel good, or my mood is just off. And we don't really know the root cause. And because this is a root cause protocol, we're able to educate them and say, wow, look, this is showing a little imbalance. And this little infection you've had seems to be a real issue for you. And wow, it looks like you had hit your head and there's this concussion that could be getting in the way. So we're really looking at the whole person.
And you are the creator of Emotion Protocol, and you've started a lot of conversation about emotions and mental health, and people think it's something that just comes on, but there is a lot of root cause to it.
Yeah, that's how this all started. Years ago, I developed this pre-COVID and said, we got to talk about emotions. There's not enough focus on it. Really, biomagnetism could be brilliant when it comes to emotions. Because we know, even in like acupuncture, Chinese medicine, we know that certain organs in the body hold emotion. So we know that the liver or the small intestines can hold heat, which then can transfer through emotions of rage or anger or irritability. So I was onto something, and then it just grew. It grew to a point where we have almost 50 emotions that we deal with now, all ranges: disappointment, frustration, vulnerability, abandonment. And we find sometimes, not always, that we'll have someone will be like, oh gosh, my shoulder's been really bothering me. And we have already found that a certain emotion, overwhelm, tends to lodge itself in the shoulder. So you'll see women walking around with frozen shoulder and have tightness, and it ends up being an emotion that is limiting the body of overwhelm. Also, we'll see at times the abandonment. Some people will have hip problems. Their left hip might bother them. And we found out that there could be some old abandonment issues going on. It doesn't always happen that the body physically manifests in that place. But sometimes when we bring it up, they go, oh my gosh, I can't believe, because that's where I've held all of my low back pain represents emotion. Or I get pain in my middle chest or my upper chest or my gut. And it's symbolic to certain emotions that the body's been holding on to. So we find that the combination of dealing with and addressing emotions that are stuck and whatever else is going on with the hormones, infection load, it frees the person to be able to look at all of this together. Another thing that I want to address is that we are a very collaborative team, meaning that the team at INDRA, we work very collaboratively together, but we also realize that it takes a village. So we work very closely with naturopaths in the area, acupuncturists, MDs, specialists, because we realize that where biomagnetism is supreme in dealing with so many issues, what if there truly is a hormone imbalance that the person does need some hormone replacement therapy? Or there's something, a thyroid condition that maybe we've picked up on and we could address somewhat, but maybe the person does need to go on a supplement or a medication. So we together work very closely with our docs far and wide, and our herbalists and practitioners, to make sure chiropractic is a beautiful, beautiful complement to biomagnetism. Acupuncture is a beautiful complement. And when we work together, it just helps the person achieve their maximum function.
So what do you think the cause of mental illness is?
So mental health is such a huge topic to talk about. And where I thought years ago, because I've worked on a chronic pain unit down in Boston and have worked with 30 years in patient care, I thought that it was standalone, that emotions and mental health issues were more standalone. And what I've realized now, especially over these last 10 years in biomagnetism, is that a lot of times we're putting diagnoses on conditions, but the root has a much different cause. So the person might be laden with a certain infection like strep or a certain Epstein-Barr virus or staph or something like that, that is causing the brain to misfire, and agitation increases, irritability increases, anxiety increases. And what we are taught in modern medicine is that Therapy is great, which I am a huge fan of, but also medications are a big backup, SSRIs. And where they have their place, we find that with the addition of biomagnetism, there's less of a reliance or long duration that the body might need of an SSRI, or when they are on a dose, they're able to manage their life so independently in a more rejoiceful way with the regular use of biomagnetism. So it is heartbreaking to me how many people are out there struggling with eating disorders, with severe mental health conditions, with OCD. And from our experience and our team's experience, when we have suicidal ideation, we see that all the time. We have people come in and we see drastic changes very quickly, which shows us this isn't just an unknown etiology. Like, we don't know where this comes from, or this is just a mental health diagnosis because something is wrong with them. This is the stigma that's been created with so many people, that they think something is wrong with them. And when we're able to identify, wow, your eating disorder all these years and this high-strung anxiety, the root of it is you've been laden with certain infections since you were young. Your hormones are now off because of it. And the emotion centers from trauma have been disturbed. When we can address all of that, it's like a relief that no one has ever felt before, because they're feeling validated that something just isn't wrong with them. And there really is underlying conditions that are contributing to the issue. So we get a lot of people who come in and have a lot of hope, because our team is a very caring team, heart-focused, heart-centered. We hold space for our clients, and they allow themselves to actually get vulnerable and talk about issues that might be very, very difficult, because we hold the space and create an environment for healing and non-judgment. So care is our focus.
It's interesting because people don't think that they're walking around with infections, where, you know, there's good stuff that you want to have in your body.
That's
But there's, you think, oh, if I have an infection, I need antibiotics. But like,
That's right.
we're always being exposed to things, and we don't
Yes,
think
we are.
that could be contributing to our symptoms.
We have a microbiome, thank God we do, or we'd all be in bubbles. We need bacteria, we need viruses, we need a microbiome in our gut, in our body, and on our skin to protect us. It's when do the scales tip too much, and there's too much that overwhelms the body. And where we do need antibiotics for acute situations, I mean, thank God it saves lives. Often they are overused and prescribed because there might be an old chronic infection, but when it's dug into the body so deeply, the antibiotic might not be able to take care of it alone. And then it can also mess up the gut. So where there is a time and a place, respectively, in conjunction with the use of biomagnetism, which is safe and effective, profound yet gentle, without a lot of side effects on someone from 2 days old all the way to someone with chronic conditions up to 90, it's a beautiful complement to many of these modern practices. I will always go back to my Ayurvedic roots, which is the oldest holistic medicine from India. And I study Vedic psychology. It is a brilliant science at looking at the root of traumas that happened to us when we were young. And when not processed, and we find this a lot when we're scanning people, I'll give you an example with men. This usually shocks my class when I teach this, but what is the socially acceptable emotion when a man feels shame? It's rage. So you'll see a lot of men will, and not to just isolate men, it happens with women too, but underneath that rage that comes out in anger is usually shame, something shameful that they've experienced when they were younger. And women the same. Women, we are taught to not experience emotion as far as anger and outward irritability and really like speaking up. So we hold it in, and then there becomes self-judgment and shame and being more passive. And what happens when we hold the emotion in, it breeds disease, dis-ease. So as we know in Ayurveda, there's no emotion, there's no physical manifestation of any disease without an emotional root. So we will look and be like, that's interesting that this same area shows up as an illness in the body or body part. And then at a time when we can relieve the emotion and bring attention to the emotion, sometimes that symptom will go away in that body part. So we really dig in a lot to emotions and bring normalcy to it, because it's, especially men, they're taught not to feel their emotions. Suck it up, don't cry, move on. And it is so detrimental, because we are all human and we are supposed to feel emotion and let it out. Except a lot of times it makes the person who is witnessing it uncomfortable to see someone experiencing emotion. And that's, at INDRA, our practitioners are very used to encouraging emotion and holding the space for it to allow that vulnerability, which I'm very proud of in my staff, for sure. We're quite a team that focuses on the care. A topic I love to talk about is, I've actually learned the most of it from Gary Brecka. Those of you that don't know him, look him up. He has pioneered information on methylation. And there are 44% of us walking around with a methylation issue. And it's a genetic condition where you can't change your genetics. But these, to make it simple, is, including myself, having a methylation issue means that we can't detox properly. So it's almost a superpower also, because we're the ones that can feel when something's not right in the body first, almost like a canary in the coal mine. There was a very cool study done about people who are poor methylators, meaning they also can't digest folic acid, which is a chemical, and B vitamins that are not methylated. So with your vitamins and things, they have to be methylated, meaning they have to be broken down and processed so the body can digest them. So I won't get into too much of that, but there's this really cool study where they took poor methylators and then regular methylators, and they told them, take this basket and go out into the forest and pick mushrooms that are edible. And the group that came back that were poor methylators, meaning they can't process or detox the right way, and they're keen as to what they can put in their bodies and maybe what they can't put in their bodies, had all mushrooms that you could eat. They were healthy. And the regular methylators had all toxic mushrooms that would have killed them. So we had this keen sense about us. Now, when we're not tuning into that, because maybe we're laden with infection, and you see, give you an example of young boys, so much exposure to computers and television and things that are fast, and schooling, and they can't sit still, and they're maybe diagnosed with ADHD. Put on Ritalin, put on Adderall. There's a time and a place, right? I'm not here to bash that. But what I'm here to tell you is, a lot of times they are, as Gary Brecka would say, they are ingesting foods that have folic acid in them. So folic acid is in anything that's enriched or fortified. So if you look through your ingredients list of your goldfish and bread and pastas, we're pumping these kids with these chemicals that they can't methylate. They literally cannot process them. And the symptom of it, or side effect, is inattentiveness, behavior issues, irritability, inability to focus. So the diagnosis might not be a true ADHD diagnosis, and more that the body's becoming toxic with chemicals it can't digest. So it is groundbreaking information that you could learn more about, but we educate. So not only with magnets, we will spend a good chunk of our session talking about methylation, because we can actually muscle test for the methylation too and be like, have you heard of this before? It looks like your body might have trouble processing folic acid. Another population with this are prenatal women that are trying to get pregnant or pregnant, because most of our vitamins the prenatal vitamins are pumped with folic acid. And so many of us, including myself, I was so sick on folic acid, on the prenatal vitamins, and I thought it was just the extra iron that was in it. Come to find out, there's a very small handful of really good quality vitamins where it's methylfolate instead of folic acid. That methylfolate, a person with an MTHFR gene mutation can process. So you have all these women walking around pumping bodies and babies with a chemical they can't digest, and then wonder why they don't feel good. Why is postpartum such an issue, possibly? And why is this child out the gate within a couple years so hyperactive? Because it's a genetic piece that's passed down from one parent or both. So that's a hot topic that we love to talk about lately. We like to inform our consumers outside of the box of just biomagnetism, because quite frankly, There could be a hole in the bucket, like a methylation issue, or an iron deficiency, or a thyroid dysregulation that we can only move so much. But if they took care of on their own with their practitioner, we all win.
So what should you look for on labels?
So look for on labels, definitely if you're looking at your multivitamin, which is the most basic, I would say, make sure that it says methylfolate. If you see the word folic acid, that's a chemical. And that folic acid is also added into the labels of Honey Nut Cheerios or Cheerios. Fortified with B vitamins. Tough thing is the fortified piece that looks like it's good to add in vitamins for almost half the population it's not so good for. And it might not be outward feeling of like a stomach ache. It could be more behavior issue. And over time, it accumulates. So just enriched and fortified, read your labels. It is also told to me that most things that are organic, like a certain breads or things, they can't add that in because it's a synthetic chemical. So just read your labels. And look up Gary Brecka because he's pretty brilliant when it comes to that. When it comes to our emotion protocol, what we find is everything generates from the heart. So this heart has this electromagnetic force that's 100 times bigger than any other organ in the body. It's got this resonance. And it's almost like when you get close to someone, you can feel the connection to them. Also, how sometimes you can feel a repel away from them. The energy just doesn't feel quite right. So with biomagnetism in our emotion protocol, the first magnet, that north pole, your true north, always starts on the heart and then moves to the organ. The next magnet goes on the corresponding organ. So I've always loved that philosophy that we all lead with our heart. No matter what place we're in or what state we're in, we all want to feel love and feel acceptance and feel heart-centered. And sometimes we just need some help to navigate that. As I had said before, that we are beings that have infection loads. We have infection loads in us. We're supposed to. It protects our microbiome. It protects us from being in bubbles. Sometimes things will just stay dormant because this immune system of ours that's so powerful is meant to run a tight ship and keep everything in check. So with that cup analogy we used, what is the straw that broke the camel's back and activated? Right? It activated a virus. I have a case right now where new onset seizures, her highest she had was 89 in one day, a 21-year-old by the time she came to me. And neurology said, yep, most likely a certain trauma could have activated a virus, but we don't really know what to do about it because the seizures are happening in the part of the brain, the emotion part of the brain, and no seizure med works for that. So maybe try therapy. That's what they came to us like that. So we were able to find the combination of dealing with the emotional center while dealing with the viral load, and it was magic, and the seizures stopped. Pretty cool information. So it's when do things get activated, then do they become an issue? So what's the difference between biomagnetism and magnet therapy? So some people will say, oh, I've had magnets. I have magnets that go in my golf shoes and help me with my arches. And I have a magnet that's a bracelet that works. And all of that's really fantastic. The difference is you're using lower powered gauss, which is the measurement in something like a bracelet or a single magnet. And that could be used over a greater period of time, repetitive days, because it just is helping, not just, but profoundly moving inflammation, decreasing inflammation, and moving circulation. So those are great tools. Biomagnetism or biomagnetic pair therapy, because you're using two magnets, is specifically and intentionally scanned for certain conditions, both emotional and physical, and there's corresponding placements on the body where the magnets go, where that load hides, whether it's specifically in that body part or, as we know in Chinese medicine, through meridians, energy meridians in the body. So when those are placed, whether it's 2 pair of magnets or it's 50 pair of magnets, depending on the condition, the body knows how to do this perfect orchestra of events where it starts to allow the immune system to wake up, and then the pathogen load gets weak. the hormones start to regulate, the emotions start to surface in a way that the body can handle. And that's kind of where the magic happens. And the body starts to feel better, the mind feels better. Topic that's a tough one, but it's a vital one is COVID and long COVID. So we do see my practice itself has changed. I always talk pre-COVID and during and post-COVID because it's a very different animal now. There's something about COVID and what it's how it's worked on the chemistry of our body that has caused some really strange symptoms for people and what they would call long COVID, meaning symptoms have persisted. Our opinion is it's less about long COVID specific and more about what was dormant behaving itself in a strong immune system. And then COVID came in a little bit of a synthetic way and activated things that just were behaving themselves. So now you've got this perfect storm of so many symptoms going on that are unmanageable and mysterious. So we also I personally work on a certain COVID protocol. And then we utilize the clinic to work on that foundational work to support the body. And then I work more on the COVID protocol itself to allow us to chip away at some of those really unusual symptoms. We see a lot of men these days who are coming to us with heart AFib, heart issues that I've never seen in 30 years of medicine like I see now. And through the work of biomagnetism, we're able to work on some of those symptoms and get people relief, which has been nice. But it's a big fish to fry, this whole COVID arena. Okay, so a question has come up about how magnets work because they attract to metal. Funny enough, I had an Army Ranger come in once, and he said to me, I cannot go in an MRI machine because I will probably stick to the wall of the MRI or get thrown up against the wall. We have patients that come in or clients that come in and they are loaded with titanium plates in their heads, rods in their spine, you name it. Biomagnetism works beautifully for that because infection likes to actually hide in scar tissue around these areas. So and a lot of these people have a lot of chronic pain from all of the metal that's in their body. So when we're able to work on them through sessions and protocol, we're not removing it. The body is doing a brilliant job. That's our tagline. The body is brilliant of removing things out of the body and the scar tissue. All of a sudden, the person has more mobility. They have less pain. They have more freedom of mind, of thinking. Everything feels better. Headaches might resolve. So it's less about we're moving metal parts in the body, but we are made up of an electromagnetic field. We are magnetic. The body is magnetic, interestingly enough, because that's how we're held to the earth through gravity. If we weren't electromagnetic, gravity would not work. We'd be floating around everywhere. So it's less about magnets using their conduction to metal in the body and more our electromagnetic field. But then the side note that it is totally safe for people that have metal in their body. We do a lot of education also around healthy diets and foods and nutrition and water and healthy relationships because all of that is so important in conjunction with biomagnetism. I also want to say that if you're hearing this and you're like, where do I start? Am I a right candidate? I would say anyone who even says, something in me just maybe doesn't feel right. I don't know what it is. Or someone all the way to having a full-blown diagnosis of something chronic or critical. Come visit us. Sign up for an evaluation. Let us dig for you. We'll do it together. We'll come up with a list and kind of put the pieces together to see why you haven't been feeling your best. And also, if you're somebody that actually feels your best and you want to maintain this, you want to live long, as we say in Ayurveda, you want to live long, but you want to feel good doing it. That's the science. We have a lot of people that come in to just do prevention to stay their best. So that cup analogy, we never quite spill over. It keeps it to such a low level that they can have maybe a loss in their life or have a cold come on and it never spills them over again. That's the point of what we do. And the body, as we know, is brilliant. It knows how to heal itself. We are just the conduits to be able to guide the body to do what it already knows how to do. And our team is caring. We focus on care and love and holding beautiful space for people to be themselves and be accepted and manifest into the best form of healing that they can.
And what's your website?
Website is INDRA.com. And don't forget about whymagnets.com, because that can give you a lot of great information, a 5-day e-course. So you can learn about, you can hear all of this and then say, I still am not sure how to explain this to people. That's a great tool for you to use. And the brilliant Caroline does all of our social media development and design. So you can reach us at @INDRA for Instagram, and for Facebook is INDRA Biomagnetism.